Welcome to the Imprint Hub, where we talk about maternal and pediatric pharmacology. Today, we're talking about some of the basics of modeling in maternal and pediatric populations. Why does it matter? What does it tell us? Does it impact clinical practice? And what do you need to know to get started in modeling? For insights into these topics, we're talking to Dr. Lais da Silva, a research professor in clinical pharmacology at Indiana University, Indianapolis. Dr. da Silva, can you start by giving us some context for why modeling is such an important tool in maternal and pediatric populations?
So maternal pediatric research is a field that faces like unique challenges. For example, there are significant ethical and practical considerations that they need to be accounted for. Here, for example, extensive pharmacokinetic studies or experimental dosing are generally not feasible for, like, for example, in pregnant women, neonates, and children. So this is one of the challenges. And another thing is that both pregnancy and childhood involve several dynamic physiological changes. For example, in pregnancy, we see alterations in plasma volume, renal clearance, and metabolic enzyme activity. But in pediatrics, drug disposition is strongly affected by growth and maturation of metabolic and elimination pathways, which all of those can change the PK of drugs. And because of these complexities and the limited amount of data that we have available typically in this population, modeling provides like a great framework to integrate available evidence and make quantitative predictions about drug exposure and response in this specific population. So through modeling and simulation, we are able to have an idea of what's going on in that population, since we cannot bring them to clinical trials like as often and actually, test those hypotheses.
So, what kind of questions are we actually looking at when we talk about modeling that might otherwise be really difficult to study?
So modeling allow us to address questions that would be, for example, like that would be impossible or at least very challenging to answer through direct like investigation, as I mentioned before. But some examples are physiologically based pharmacokinetic models or PBPK, for example. They can predict fetal exposure by simulating placental drug transfer, or even like we can use that to estimate drug concentrations in breastfed infants through lactational transfer. In pediatrics, the models they can guide in dose optimization and also um, like dose optimization for neonates versus like older children by accounting for differences in the organ size, maturation, and body composition. All of those things are going to be different according like to different ages. We can also evaluate for what if scenarios for instance, how drug exposure changes in preterm infants or in children with impaired like renal function. One thing that is important to mention is that these models they support like a rational dose selection and also safety assessments in populations where empirical trials, are typically not available.
So, when you say rational dose, what do you mean by that?
This is a more detailed and like actually using real data and information from that population to find the dose that is going to be appropriate for them. So when I'm saying rational selection, I'm talking about making an informed decision through this modeling and simulation work that we do using the actual data in that population.
So, let's say that you are a practicing clinician and you have a maybe a child that you need to figure out how to dose. What would the model actually tell you about dosing that kid?
Yeah.
Like why can't you just scale down the dose of what you would give to an adult and size it down to a kid? What other pieces of information are going into that?
Yeah, that's a great question, right? Why not just like using like a direct extrapolation? It depends on the case, but like the great thing about like the models that we have available these days, for example, PBPK models, they bring like this component, like the physiologic component that which is unique to that population. So with the physiology, with the right physiology, plus the information on that drug, we can create like we can get use the physiological information that we get like from clinical assessments in the specific population we are interested at, and then bringing the drug information component on that, those two together allow us to make a more realistic decision. It's essentially we are creating like virtual populations that they're like at least like identical to the real world population, or at least close to that, and bringing their physiological information, and then combining that with the drug information, we are able to actually find like the right dose, or the dose that is going to be most successful, because we are using information like from the real world.
Why do you need to have a separate model for different drugs? If the kid's body works a certain way versus the way that it works for an adult, won't that apply to all drugs?
So, because each drug has a unique characteristic. So essentially what we're doing here is getting like that unique information from each drug, you know, combining that with the unique information from the population, and to with interact with the interaction of both parameters, like set of parameters, we can do this assessment. Now, we cannot use for all the kinds of drugs, because each drug is going to behave differently in our bodies, like we're going to end up like with different amounts in different places in our body. So we have to have that specific information for each drug when we are doing this dose optimization in a specific population.
So, for somebody who is just starting out studying all of these topics, what would your biggest piece of advice be as they start learning about modeling?
For modeling work in this field, like it's very, very important. I would say like the first step before you do before you start work doing any modeling work, but you plan on using modeling and simulation. For that, like your first step should be understanding the PK of the drug itself and the characteristics, like physical chemical characteristics of the drug. So I usually say try to understand everything you can about that drug itself, and seek like PK information available out there for that drug in particular. Once you understand, the science of the process like related to that drug, then it's a good then like the next step would be like bringing that information to a simulator, or any independently of the type of tool you're using. Once you understand the PK, then you can start the model.
Are there any skills that you recommend that somebody just starting out develop?
And again, like it's very important to have the working knowledge of PK, like very basic level, like working knowledge of PK and PD principles. Very important to have a good knowledge of statistics when we're working with this type of, when we're working with modeling and simulation for pharmacology. Understand, like having some appreciation for the differential equations that are going to be used, and also some programming skills is always helpful. It's not often required, but it always help you. If you're looking for a job or trying to work in the field, it always helps to get like to acquire when you like have already like some modeling skills, uh, programming skills, for example, in R, MATLAB, and also experience like with the most important softwares I would say like being used these days, such as like Nomen, Monolix, or Sensafe, and GastroPlus, and so on.
Thank you so much to Dr. Da Silva for joining us today, and thanks to you, our viewers. Let us know down in the comments below if there are any other topics that you might be interested in, and we'll see you next time.